right, I'm going to show you how to circulate. So when I first come in to circulate, before I bring my patient back, I need to come down to the OR and check my room. First thing I'm going to do, turn on my lights, turn the yellow all the way up, and then this one, I need to change it to the right side so it's brighter. Then I'm going to make sure all my supplies are ready to go here. I got my catheter, my scrub, whatever the physician dressing is. I'm going to pull whatever SCDs I need. And then I got my mother's pack here. I'm going to pop over here and I'm going to get the baby warmer turned on and set to 25%. I'm going to check my bed. Most importantly, is there a cover mat on here? And there is. SCD machine. I'm missing a pillow, so I'm going to grab a pillow and bring that back. I'm going to turn on my two machines. I'm going to stick a manifold in here. Come over here, I'll show you how to turn this one on. There's just a little switch down here to get that one fired up. And make sure that the C part looks good. I've got the pulse ox. When I bring the patient down, I'm going to make sure she's got her blood pressure cuff on her arm with her. And then my monitor is ready to go. That all looks good. And then I'm going to make sure that there is pit in the warmer. Okay. About 5 to 10 minutes before my case starts, I'm going to make sure my patient needs to get up to go to the bathroom. And then say it's a 7:30 in the morning case, at 7 o'clock I'm going to walk her down here. I'm going to bring my bag of IV fluids, I've got my antibiotic in my hand, and I've got my whole chart in my hand that I'm bringing all down with me. So here we are, walking down. Once we get in here, I'm going to make sure she gets a hairnet on, and then we're going to head into the section. All right, now that we're in here, I got my patient sitting up, ready for the placement of the spinal. It's very cold in here, so we want to make sure that she's calm and comfortable. So I'm going to grab her a warm blanket. That's better. So I've also put my antibiotic and my anesthesia consent up on the anesthesia cart so that the doctor can take care of those things. So I'm going to stand here and I'm going to wait for the placement of the spinal, and then once the doctor says it's okay, we're going to help her get laid back. As soon as she's laid back, we're going to immediately start putting the catheter in. All right, catheter's placed. I'm going to stick it under her leg and let it dangle on the floor. And then we're going to get SCDs on. Plug them in. And then I'm going to make sure that my machine is on and working. The next thing that I'm going to do is attach the bogey pad. So I've got this here. This slides in like a seatbelt, clamps shut. This is going great. Pull the sticker off, and then it's going to go just above her knee with the cord facing down. Machine on to the doctor's settings. Dr. O'Rourke likes it at 40 and 40. The others like 45, 45. I don't do anything over here. Now, I just realized that we're missing an arm board over on this side, so I need to get this attached so she's a little more comfortable over here. It has a claw on the end, so I'm going to use it to grab a hold of that metal piece and let go. Now, there's also, when you get under here to see, a little T-piece here, and if I pull that out, I can swivel it side to side. Come back and mess with these beds if you haven't, so you can get used to doing that. Okay, now that we've got her all in bed ready to go, I need to cover her up with another warm blanket. So let's pretend I grabbed another warm blanket out of the One more. Cover her legs up. Strap her legs down. And then I'm going to fold this blanket down over that strap. I'm going to kind of lift her gown up because I'm ready to do my abdominal prep. Make sure before you do this that you don't have any stethoscope hanging, no jackets, loose, heavy, anything that's going to dangle and get in your sterile field. So I'm going to open my prep, and I've got my gloves on. Now you squeeze this to break it open. I'm not actually going to do it because education will kill me, but the orange fluid will start filling up on this sponge. I am going to start right over the line of where her incision is going to go, and I'm watching my clock, and I'm going to scrub that for 30 seconds. This is not smooth, so I'm just going back and forth over this, kind of pretend, but really make sure you're scrubbing that good. And let's say it's been 30 seconds now. So now I'm going to go back and forth all the way to the side on both sides, making sure I'm really covering all the skin. You don't want to miss any spots. And you're going to do that all the way up, about 2 finger widths above the belly button. So her belly button's here, so I'm coming up to about here. No matter what you're doing, you never want to go back down over the side of the incision. Now that that's clean, do not touch it again. So after I do her belly, then I'm going to come over and do her thigh. So I'm going to start at her hip and scrubbing down. And sometimes people have different techniques of doing this, and that's okay. Just make sure you're not going back over areas you've already cleaned and that you're not touching this to anything else. After I scrub that, I come over to this side, and I'm doing the same thing, really scrubbing, making sure I'm getting all the skin. And now I have to do this area, the mons. So what I'm going to do is I'm going to swipe here, here, and sometimes some of our patients are a little bit wider in this area, so you need to go back and do all that skin too. Just don't touch your incision. And then you're going to do one swipe down the middle all the way down over her labia. And then you're done. Now that the doctors have put the sterile drape on her, they're going to throw off the suction and the bovie, so I'm over here ready to catch. Once they throw off the bovie, the green one, I'm going to plug the first thing in here, and then the suction tubing, I'm going to plug in over here. It goes in the 7/8 hole there. And then on the back of here, to set it up, I'm going to hit confirm. We're just turning it on. Evacuate smoke on. Never put it on auto, and it should automatically go to 40%. And then I'm going to turn my suction up to about 400 and hit start. And then my second suction cord, I'm going to plug in to one of these outlets. Okay, now that we have her all sterilely draped and her partner is brought in and sitting at her head, we're going to do our timeout. So I'm going to say, let's do a timeout so that everybody can hear. There shouldn't be other chit chat going on in the room when I do that. I'm going to say, this is patient's first and last name, date of birth, 10/27/1990, here for a repeat cesarean section. We'll say the whole name of the procedure. Her antibiotic is in, her catheter is in, her SCDs are on, her bracelet's correct. I'm going to physically go over and check her bracelet, make sure it's her name, her date of birth, and the right procedure on here. And my consents are signed and correct. The surgeon has now started surgery, and I am pulling my bucket and my latch over so I can calculate my blood loss. Right now, I am watching the surgery and I'm anticipating anything that might come next. So if it looks like he's going to need a vacuum, extra supplies, and if we're going to need any extra help, I'm keyed into all of that. The anesthesiologist will communicate with me if he needs anything. So that's what I'm waiting for. And